Record. Okay, this is the seventh chapter. Um, we'll go quickly over it. Okay, the seventh chapter is first aid in mental health, which is a very practical and a good chapter. If you're doing the first six nicely, then um, yeah, it's this may you can just go over this chapter if you're like totally thorough with everything in the first six chapter. Otherwise, if you want to do everything little, or like if you want to be prepared with everything, good to do this one. Okay. So basically, introduction is here that your body's immune system, which might already be compromised due to, okay, what I've just marked this much. Um, okay. Yeah. So for a healthy life, we have to, we are given some advices that you're supposed to do this and you're supposed to do that, and exercise and good food and sleep well and everything. Okay, so that why do we do this? Because these are like the preventive measures which are taken in order to protect our body. Okay, hold on. They're taken to protect our body's immune system from um, stress during examination. In the same way, today we are going to be speaking about mental health. These statistics are really important because usually we only study about the statistics abroad. So these are the statistics in India. Okay, that 10% of the population suffers from common mental disorders, 1.9 from severe, and 13.7 um, they of the Indian population will be diagnosed at least once in their lifetime with a mental disorder, which is quite a lot of people. Okay. Um, so yeah, it is very important that you have to, even before mental health is disorder is diagnosed, it's important to take care of it. Okay, because we have stresses every day in life, like work pressure, crowding. All of these things are a regular stressor. In fact, students in India, I feel, have so much stress regularly that we have to make sure that we take good care of our mental health. Okay. Mental health first aid, MHFA, is an internationally recognized training program. Okay, it was developed by Betty Kitchener. In fact, India also we have this thing, and I'm a part with a group of psychiatrists where we do like free awareness sessions for people on mental health first aid. So this is a very important thing. Okay, and um, yeah, Anthony Jorm also, for professor from Australia. Just important to remember this. Um, okay. Why do you need a mental health first aid? There are, firstly, there are a lot of hurdles in receiving treatment. Okay. The problem in India, at least with physical health, is that, okay, now if you know that you're falling sick, you go to a doctor. Okay, earlier there used to be a lot of problem in approaching a doctor even with physical health because people used to think कि हम ये पूजा कर लेंगे या ये कर लेंगे तो ठीक हो जाएगा. But now people have started realizing, even if they're not educated and even if they come from remote areas, they know that if you're falling sick, you go to a doctor. Right now, with mental health treatment, there is still a lot of hurdles, which include knowledge, awareness, cost of treatment, no explanations from medical explanations for mental illnesses. Like people have suddenly started behaving like, okay, they are talking to things and they're hearing voices. There is no medical, we can't explain it to them कि इसके वजह से हो रहा है. So people think this must be maybe black magic or something wrong. Till date, people think like that. Again, there's a very huge shortage of trained mental health professionals. Um, People are unwilling to get treatment because of stigma, of course. People think कि mental health मतलब पागल हो गया है, only then you go for a treatment. For basic stress, depression, people think okay, if I go to a psychiatrist. In fact, most of the people who come to me for counseling, they come like without informing at home, most of them, because till date there is so much stigma around taking mental health treatment. There are untrained individuals giving wrong advice, of course, wo to hai. It's just like those lot of rickshaw wala, like when you're traveling and then you ask them, "Bhaiya, rasta kya hai?" They don't know it, but they just say, "Aise right le lo, left le lo," and then you're kind of in trouble. So yeah, untrained individuals give wrong advice. And slow improvement of individuals' behavior, because this is not like medicine. You got fever, you ate medicine, and you were okay. Okay. Stigma associated with mental illnesses. There's a huge stigma. That is one of the major obstacles in getting help, because there's so much stigma. Okay. We fear things that we don't understand. This is like a Batman film kind of a dialogue. But yeah, that's true. We do get scared of things that we don't understand. And yeah, that's why there's a lot of stigma associated with it. The lack of knowledge and awareness makes us, for example, do a lot of these things. One is we blame the person. Okay. For example, if someone's going through depression, we start blaming him. That ये क्या कर रहा है, this because of him, this happened because of him. He's only being the bad person. Like someone with depression doesn't want to go get up, get out of bed. We start blaming him, lazy hai, alsi hai. Parents, in fact, a lot of times they start saying that, you are not hardworking, you are not this, you are not that. We start doing that. Another thing is that we think that, so a lot of people do think that mental health is because you have done something wrong. In fact, this is not just for mental health. I've heard people, like doctors say this to patients also sometimes. That, oh, you did this sin and you must have done something wrong in the past. That's why you're getting cancer. That's why you're getting mental depression, is because you were a bad person, which is not necessarily true. Obviously, it's not. It has nothing to do with your behaviors and your so-called sins. We think that the person is intentionally behaving in an appropriate way. जानबूझ के कर रहा है. I'm doing so much to help him on purpose. He's doing this. Okay. The next one is shame. Uh, okay, so when a person is trying to hide, when person experiences shame, you're ashamed of something, like you failed an exam, you try to hide it from other. Not just an exam. For example, if a girl left you or something like that, or like say for example a man's wife left him, so that brings a lot of shame, and they don't want to discuss it with others. They want to hide it. They want to hide it from others. This also stops you from getting mental health treatment, because obviously छुपा के रखोगे तो treatment कहाँ से मिलेगा? Okay. So because we feel that, okay, if you fail in your exams, you're a bad person. If your wife left you, if you go through divorce, or say suppose you come out as a gay person, okay, it means you're bad, you're bringing shame to the family. So we start hiding, we stop interacting with other people, which actually makes our mental health condition worse. We go through like a worse situation because of that. And that's why a lot of times you don't even want to talk about it. Like abroad, if you see, people are still open to talking about their feelings. Okay, I didn't like this, I felt this when he left me. Here we don't talk about it. We feel like, okay, इसके बारे में बात ही नहीं करना, and that stops us from reaching out to others. Okay, and we don't seek mental health guidance. Okay, and basically mental health is caused by a complex combination of factors like genetic, socio-cultural factors, and environmental factors. And it is never caused because of personal, never in capitals, which is true, never caused because of personal weaknesses. Blaming the individual who has been diagnosed is not correct. Okay, it rather puts them in a bigger trouble, and it's very beneficial to provide and understand and support the person who is going through this problem. I'll share like a very small quick insight, is that a lot of times, like I know of somebody very successful in their life, okay, at a very young age, in a very old days, did extremely well in academics, very high paying job. But the social stigma, okay, because she got married to someone she liked. And that time there was a lot of social stigma, you not accepted this, that. That person worked so hard for her entire life. She was not accepted. Ended up getting never accepted in the boy's family, and that way. And a lot of stressors from her house, from the boy's house, caused her, we can't say that that was the reason why she got schizophrenia. There's also a lot of genetic, cultural, environmental, but she is under through a lot of stress, couldn't reach out, couldn't speak to anybody about it. And such a talented person, very well known person, has to go through a lot of problems. So mental health problem, and then the entire life, because schizophrenia is like one way, people don't, it's not very it's not a very curable kind of a thing. So it's a very difficult situation to be in. So best is just seek support. Anything goes wrong, it's no harm in asking for help. Everybody goes through tough times in life, and it's okay to reach out. Okay, the third one is people don't always know how to respond. Like sometimes you want to help someone, but we make them feel worse. It's like, so for example, somebody is crying, he left me, and they'll be like, अरे you say something like, अरे यार ये तो कुछ भी नहीं है, मेरे साथ तो और भी बुरा, और ये तो कुछ भी नहीं है जिंदगी में, और बहुत कुछ बुरा होने वाला है तेरे साथ. You're trying to kind of tell her कि okay, don't worry, this is just a small thing, but you're kind of making her feel worse. So here they've given some dialogues about how you can help somebody who's going through something. Like for example, he's feeling bad about his brother leaving and all of that. There are ways of responding which you can read. So it gives a good example of how you can respond, which we will also discuss later. The next one is people with mental health illness don't always seek help. So they samne se don't go for treatment. First, there are a lot of reasons for that. First is culture. In our culture, the behavior of an individual is considered to be a reflection of their family. If a child doesn't behave well in the mall, we'll be like, oh my God, look at that mother, how she's raised him. We start, or somebody who doesn't get good marks. Parents compete with each other. Oh, your son, my son did medical. What is your son doing? So they kind of have a competition. In America, for example, if a big actor's son is not a big actor, we don't say कि a big actor is bad. Okay. But in India, अगर बड़े hero का बेटा is not very successful, we start blaming the big actor कि oh, because of him this guy is not successful. So here it's a reflection of the family, and the stigma attached to mental health may prevent people to hurt. Okay, what if hurt the reputation of their family? So many times the clients, okay, if I tell them, okay, can I speak to your father or your mother, they'll be like, no, 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 no. He'll think that he did something wrong in raising me. But that's not true.
Ma'am,
Okay.
will stop 1 minute.
Yeah.
I'll get the dough Mohammed's from.
Okay. Okay. So, yeah, the another one is advice from elders. They many times they incorrectly believe that advice from elders alone and guidance will be enough to cure your mental illness. So, adults will be like, okay, you know what, just do this, do that. People feel like, okay, theek hai. Another thing is superstition. A lot of people think that, okay, it's supernatural forces which are, or mental illness is caused due to some sins or some things like that. So there's no there's no need to go to a mental health professional. Okay. Yeah. Okay. they don't usually think that mental illnesses can be treated by psychotherapy or modern medicine and all of that. Okay. So, but the first aid in mental health is based on the idea that prevention is better than cure, because certainly, obviously, once you start getting it, a lot of times you cannot really do much after um, things go really bad, or it takes a longer process, it takes more efforts. So usse acha, before things just go wrong, we just at least be aware of, okay, these are the things. Like we know for a fact that agar your fever goes above 103, 104 for more than a little time, you have to go meet the doctor, because then there's a chance of fever going to the head and all of those things, right? So we know basic things ki, okay, we don't wait for it to go there and then there's people go into coma or something like that. We immediately go meet the doctor. In the same way, mental health ka concept is you understand what are the signs and all of those things, so that you can reach out when you need. Okay. Okay, people, so there are often, people say कि अच्छा कल तक तो अच्छा था, अचानक ये हो गया, अचानक डिप्रेशन हो गया, अचानक स्किज़ोफ्रेनिया हो गया, अचानक कैंसर हो गया. It doesn't, अचानक doesn't happen. There are always small and subtle changes where individuals feel something's not. There are small things that keep happening in your brain, just like in your body. You have to observe those. You have to notice. In fact, a lot of times physical things you may not notice, But mentally, even something like cancer, a lot of times it's psychosomatic or a lot of other disorders. Start noticing your feelings or changes in your behavior. If you're not feeling the same way, you used to love doing something, you're not feeling the same way, start noticing such changes. Okay, so these are early signs. If they are recognized, they can help in the following ways. One is diagnosis. So you can, it might prevent a severe form of illness from developing. Like, best is one example of this. One person um, I was dealing with, and very high chances that get she could get something like cancer in the future, because it was in her genetics, it was in her thoughts, it was in a lot of those things. But yeah, if you deal with those thoughts at the right time, resentment towards someone, hatred towards someone, you can't forgive someone for the unfair treatment. If you deal with certain feelings, recognize certain feelings, or with somebody who could have had like major, say, suicidal tendencies, after, if that person did not deal with a certain kind of stress, because he was into, big businesses and all of that. So that this thing helps. Okay, diagnosis ki, okay, you're prone to depression, you're prone to anxiety, you're prone to this. The other thing is intervention, that is, what can you do to get help. So we can help you get early intervention. The third is relapse prevention. So if it has already occurred to you, we can make sure that we can prevent the reoccurrence of that thing. Okay, this is the algae plan. So be the difference in one's life. Okay, algae plan is basically helping you to understand what are you supposed to do if your friend is in trouble. Okay, we have an image in our minds that someone is suffering from mental illness will behave like, be violent, talk to themselves, or dress in a bad way, or something like that. But in majority of the cases, people just appear absolute, especially something like suicide. They'll be like, oh my god, ये तो एकदम हंसता खेलता था, ये तो मुझे मिला भी सुबह को, he was so nice with me, he was laughing, he was having fun. So we feel that, okay, if he's having mental illnesses, वो जो movie में दिखाते हैं ना, he's drinking too much and sitting in one place and not eating and his hair is bad. It's not compulsory. They might appear totally functional, but they might just, things might happen. They might just take some steps as much as suicides. So there are some red flags. What can you do? They might still show you some red flags. These are the things that you can do to prevent them from a bigger problem. One is to approach, assess, and assist in any crisis. Listen non-judgmentally, give support information, encourage appropriate professional help, encourage self-help and other strategies. We'll quickly go over it. The first is approaching, assessing, and assisting. So for normally what we do is we run away from negative feelings, bad feelings, right? What here they are saying is that, and we want to avoid it because we don't like to talk about it. We just kind of run away from it. So here, and for others also, it becomes like, okay, if this person is going through depression, we don't want to talk to him, obviously, because uh, it makes us also feel a little uncomfortable. Okay, what if the person may appear rude or may appear distant or may not want to talk. So we are also kind of scared, not sure if we want to approach. So they give two examples. This one guy, Rahul, gossiped about it, and yeah, instead of mute spectator, he could have, you need to approach directly the person. Okay, instead of talking behind the back, this guy's behaving like this, he's doing this, he shouldn't do this, I did so much for him. Instead of doing that, better is that you address, okay, go to that person and assess the behavior of the person through observation. See what are the behavioral changes in him. Okay, and maybe you can approach them. Hey, are you doing okay? We have seen this guy saying, hey, Ali, we have noticed some changes in your behavior. Please tell us if there is anything you would like to discuss. It's a good way. Second is listen non-judgmentally. When a person is going through a certain phase, they might unnecessarily feel guilty about unnecessary things, or may just be crying about small things, that, oh my god, or some small things that you might feel, okay, this doesn't even make sense, like some small failure, and they'll be like, oh my god, I only fail in life and all these kinds of things. You'll be like, oh god, this is so stupid. But that doesn't help. You have to be non-judgmental when you listen. Don't get your own views don't let them influence you. Don't start criticizing them. They should not feel criticized or judged, or their feelings should not be negated. इंडिया में बहुत ये भी बहुत होता है कि भाई ये ऐसा सब कुछ नहीं, इफ यू से ना मॉम आई एम फीलिंग स्कैर्ड, आई एम फीलिंग स्ट्रेस, ऐसा सब कुछ नहीं होता, जाके एग्जाम दो. द चाइल्ड इज सेइंग कि मॉम आई एम फीलिंग एक्सट्रीमली एंग्शियस, इज समथिंग गोइंग रॉन्ग. नहीं नहीं कुछ नहीं होता, जाओ एग्जाम. Don't do that kind of a thing. You have to listen. In fact, listening is the best thing that you can provide to a person who's suffering from, and it helps tremendously. Okay, you have to show them empathy, that okay, I understand. If just imagine, and how you can show empathy is that you have to imagine if you were in their place. Okay, they might just, for example, this girl in the orphanage, I used to regularly visit, she went through severe depression phase. Okay, um and she would cry in smallest thing कि मेरा कोई नहीं है मुझे, and then I'd be like, okay, I'm here with you, I'm talking to you, but she would always say कि मेरा तो कोई नहीं है, मुझे तो कोई, मैं जीऊं भी क्यों, मैं मर जाऊंगी तो अभी किसी को फर्क नहीं पड़ेगा, those kind. And she was just in that loop constantly. And then I used to, and a lot of things, like if somebody is like even doing something for her, she'll be like, ये भी मतलब के ही है, 2 मिनट के लिए आते हैं. So I'm like, okay, come on, be grateful she's doing. But these are my, I can't let my, then I thought of, okay, what if I was in her place? I visualized myself there. Okay. And this time, even I was like in 12th standard, 13th, like first year in college. So that time I was not 100% sure what am I supposed to do. I started imagining myself in her place, and it helped me understand why is she going through that phase. I imagined, okay, she comes from a family where she was thrown away in a plastic bag in the dustbin because her parents didn't want her, and her aunt and uncle, like her aunt took her, and then the uncle would beat her because uncle's money would go in feeding this girl who was not even his daughter. She had ear problems because 100 other things. Now that makes her feel rejected. As a child, she didn't feel that way because now she was growing up and she was understanding that, okay, this is how it feels. Now she's having an identity. So that's why she's having that crisis ki mera koi nahi. Think about her. The next is give support and information. Okay. So you can just basically say that, okay, provide genuine support and say that, um, yeah, it makes them feel that yeah, they matter, they are important, their feelings are important. Most of the time mental health issues come related to things that I'm not being accepted, I'm being rejected by others, or I'm not liked for who I am. Just try to make them feel that you are important. And people who get support, they feel more in control of the situation, and it just basically helps them remind themselves that they are not alone in dealing with this. When you know that you have support, it's like parents. Most of the times kids who have good parents, they don't worry about, oh my, they don't easily get mental disorders, no matter how difficult the crises are, because they know कि okay, I have support. Next is encourage professional help. Very important. You have to, just like you go to a doctor, you have to send them to a mental health practitioner who is trained. Make sure that they are, send them to the right person. Very important. Most of the times people directly go to a psychiatrist. Okay, maybe you just need to go to a psychologist, the psychologist, and that to a counseling psychologist, because counseling psychologists are trained in counseling, in figuring out. Clinical is for majorly for diagnosing and clinical related issues like uh, severe issues, and psychiatrist is majorly, they give you medications. Not everybody directly has to go to a psychiatrist. So important that you go to a correct mental health professional. Okay, know who you have to go to. They're supposed to be trained, because a lot of times, see what happens in America, they all work together, counselor, psychiatrist. In India ऐसा नहीं होता है. So a lot of times, some things which are basic that you just need to, you can be okay with in a counseling, like you have basic stress, okay, school exam, academic stress, best is to go to a counselor, go meet a counselor, because they'll do counseling. There are some clinics which do all the three together, but sometimes some people do unnecessarily just or go to the wrong place, and then for small issues you don't really need to, it's like khasi ho rahi hai, you don't need to get yourself operated. So if you're feeling cough, if you're just having general cough, go to a general doctor, don't go to a surgeon. It's the same. Okay, the next one is encourage self-help and support from others. So you can just tell them, in fact, if you have friends who are showing signs of suicidal behavior, first thing, inform the parents. No matter what secrets you have to keep or anything like that, inform the parents. Don't keep them alone. Tell them to seek support, social support from loved ones. If they don't have family who they can trust or anything like that, a lot of other things. I mean, you have to do such things, okay? Tell them to go take social support, inform people around them. Okay, self-help strategies refers to tasks that you can perform yourself, like exercising. These things help a lot. Self-help is very reading is very good. Reading self-help books, amazing. Some of the examples are like sleep hygiene, reduce time, screen time, and digital involvement, physical activity, engage in activities that you enjoy doing, um, and making hobbies, and build and maintain social support. Okay, first aid in mental illness. So first aid in depression. Um, yeah, I believe we don't have. Okay, this side we do not have basically, but you can just still read if you guys want to about what can you do, what are the changes seen in a person with depression. Okay, like,
Is 88 and 89 are cancelled now?
yep. Yeah, I'll just still quickly go over it. Just basically, you know, I mean, I've been speaking about depression regularly, even in the sixth chapter. They either sleep too much, too less, they get aggressive sometimes, especially in kids. Aggression is a very, they get aggressive because they don't know what to do about it. Perform bad in exams, avoid friends, don't enjoy the things they used to enjoy previously, all of those things. Next is first aid in anxiety. In anxiety disorder, anxiety is very, very common for students. Anxiety is basically uneasiness, apprehension, and tension which stems from anticipating danger, which means that you are feeling uneasy because you're anticipating something bad's going to happen. Happens a lot of times before an exam. A lot of factors which contribute to anxiety include genes, your brain chemistry, because there's an imbalance of certain neurotransmitters, a traumatic event, you know, like abuse, rape, sudden death, parental divorce, stress about college exams, all of these things. So, anxiety basically can be a matter of concern if it starts interfering with your daily life. Okay, there are a lot of types of anxieties which we've already done. Um, Social phobia, separation anxiety disorder, acute stress disorder. In general, there are a lot of symptoms which you can read, very self explanatory: palpitations, rapid heart rate, shortness of breath, dizziness, headache, restless, shaking. Psychological include symptoms include mind racing. You go blank. A lot of times, parents don't believe students. They say that we have studied, and they go in an exam get blank. Parents are like, "नहीं झूठ बोलता है, पढ़ाई नहीं किया," but it's not true. Anxiety can make them go blank. You can't concentrate. You may forget, problems in decision making, irritability, avoid people and situations, repetitive checking, strong urge to escape a certain situation. Okay. Now here we have certain steps of anxiety, for which I will start a new which I'll start a new session. Okay, like a separate video. So, oops.